thanks to the Institute for asking me to talk here today. So I'm a postdoc researcher in UCC, and I'm also the project manager for the Model for Dementia Palliative Care project. So I'm just going to give you a little bit of background to the project first, as kind of to give the context of how I was using the EMTReK model. So the Model for Dementia Palliative Care project aims to improve the palliative care of people with dementia and their families by developing a service delivery model. The model will map out what services, assessments and treatments the person might need and where they should get those, so that the health system can better organise their care. I suppose we hope that the main impact of this project and the model is that people with dementia will be supported to live well at home in the community for as long as possible. So it's a AIIHPC funded project. It started late 2017, so we're about a year in, and it's going to be a 3-year project. So we're about a third of the way through. And also to point out, so the original project, the 3-year project, is AIIHPC funded, and we also recently were successful in getting some KEDS funding, like Siobhán mentioned earlier. So we're going to use this as its supplemental funding to even increase the KTE activities that we're doing. So with this, we're lucky we're going to have a new researcher on the project 1 day a week, totally dedicated to doing KTE activities. And the extra activities into what I'm going to be talking about today, we're also going to be doing a national conference with the National Dementia Office and developing infographics and videos. So that's really going to even expand on what I'm talking about today. So I'll just briefly mention the project team. We have a great team. The PI is Suzanne Timmins, and the project steering group is collaboration between UCC, Ulster University and UCD. What's been really, really useful in the project as well is that we have a fantastic external advisory board. So this includes public and advocacy groups, including people with dementia, family carers, organisations like the Alzheimer's Society, SAGE, Irish Hospice Foundation, and also a wider professional and policy stakeholder group, which includes academics, clinicians from lots of different settings, and these are from different countries as well, so across Ireland and the UK. Okay, so just a little bit more detail about the project before we go on to EMTReK. So overall, there's 6 work packages that are going to help us develop this model. So the first work package is all about a scoping review to identify what the literature says are the key components of a good model, or what kind of models have been researched or assessed before. Work package 2 then involved a survey. So 1, to ask key stakeholders what they felt a priori were important components of a model, and also to identify existing dementia palliative care models across Ireland, Northern Ireland, England, Scotland and Wales. So then we're going to choose from that long list 3 to 6 services to evaluate in great detail. So we're going to identify the really good examples and do detailed site evaluations and develop logic models of those in work package 3. Work package 4 then is all about drafting the model and refining that based on feedback. And work package 5 is an economic analysis basically, so looking at the value of the model. What I really want to draw your attention to is work package 6. So out of the 6 work packages, from the start we had planned KTE as a core work package. And I suppose it's important as well that while work packages 1 to 5 kind of happen sequentially, work package 6, you can see that we've that planned throughout the project. So it's running from the very, very start to the very, very end. So some of the activities that we planned within our KTE work package include relating with existing key projects, so such as the SEED project and the Compassion project, which would be kind of similar to ours in the UK. And we do have researchers from those projects on our EAB. We also identified that stakeholder input is going to be a key part of every work package. And we've done that kind of in different ways for each work package, but also that we have key stakeholders on the external advisory board means that they have oversight the whole way through as well. Obviously, we felt that dissemination to researchers was really important, but we also felt that dissemination to the public was going to be equally important, and we kind of planned a dissemination strategy around that. Okay, so I'm just going to give my experience of how I applied the EMTReK model. I probably didn't do everything perfectly, but there's definitely some learnings I can share with you today. From working with George and Suzanne previously, we knew about the EMTReK model before we thought up this project and went for funding. So we had kind of started looking at it at the actual grant writing stage. And I do think that was really, that definitely went in our favour when we were applying for the grant, that we did have the model in there. I mean, like the AIIHPC does have dissemination, PPI, those are all important parts of a grant application. So definitely it was in our favour that we use the EMTReK model. Then I suppose it was after the project officially commenced that I really formally looked at the EMTReK model again. So what I did, I just got literally the worksheet that I think is in all the packs that comes with the model, and I filled that out in quite a bit of detail. But I didn't kind of do this all in one sitting. I did a draft first and came back to it every now and again throughout the project, and I'm still coming back to it. So it's something I think we're going to keep adding to as the project unfolds. So definitely I think the easiest place to start when filling out the EMTReK model is the message. And I've just kind of picked out a few snippets of how I filled out the EMTReK model. So the first thing about the message is that it asks us to think about how the knowledge meets a user need. And I think this is easy enough in our project because we are going to develop a new agreed model for dementia palliative care for the Irish healthcare system. And that's something that was identified as being needed. The model also asks us to think about how knowledge is accessible. So this is just something that was really useful to reflect on, that we're going to have to produce evidence that's valid to both academic and non-academic audiences, and that we'll therefore have to use kind of different language to translate the message to all those different groups. I think this one is kind of useful, and it kind of came up there a while ago, that multiple types of knowledge are valid. So when we're developing our model, there's going to be different types of evidence that go into developing it. So some of it's going to be quite systematic or quantitative evidence, but some of it is going to be qualitative evidence from feedback from people with dementia who get to see drafts of the model. And I think it's really important that we and that others recognise that both of those types of knowledge are equally valid. So just because there's no research evidence to support some component, if all the people with dementia and their families say they want this, that's equally valid, that's equally important. So from talking about the message, that brings us on to the stakeholders. So one of the key stakeholders are the knowledge producers. There's multiple knowledge producers, and one of the main ones are, of course, the research team. So there's a few things that we were kind of prompted to reflect on as researchers, and that was just to be aware of how our own kind of personal values and beliefs might affect the messages. So we might have some assumptions already about dementia palliative care. We obviously think it's really important. We have to make sure that just because we assume, that we know it's important, we can't assume that everyone else feels the same way. So just kind of reflecting on your own values. Then we're prompted to think about the different knowledge users, and really there's a whole host of different users of the knowledge from this project. So this includes policymakers, healthcare service providers, healthcare workers, researchers in dementia or palliative care or service delivery, and probably more onto that as well. So it's really quite broad. Similarly, there's many different knowledge beneficiaries. So it includes people with dementia, and their families are going to be very directly affected, but also any member of the public who may be diagnosed with dementia in the future. So that affects all of us really. So getting those key messages out to the public at large. And also say dementia advocacy groups or other key organisations. Okay, so then after kind of looking at what are the key messages, who are the stakeholders that need to hear those messages, thinking about the processes then is all about how will we translate those messages to the stakeholders effectively. So part of the model that we looked at already is that it involves an interactive or two-way exchange. So again, the EMTReK model then prompted us to think about how our knowledge transfer processes are going to be dynamic and collaborative. So for example, when we draft up the model, we're going to get feedback at every single stage from a stakeholder group of people with dementia, service users, service providers as well. The model also talks about opinion champions, and this is another one I think that was a very useful prompt for us to think about in our project. So I mentioned that a key piece of work we're going to be doing is site evaluations of existing palliative care services across Ireland and the UK. So what we've planned to do is identify a local champion at each of those sites before we go. So the idea is that this champion is going to be someone who, we meet with them first, tell them all about the research, and someone who will kind of support us doing the research in these sites. So hopefully that will kind of help get over any barriers of doing research in kind of active settings. The process also asks us to think about using very diverse activities. So again, I guess because the messages we're trying to translate are very diverse, the stakeholders we're trying to target are very diverse, it makes sense then that the activities that we use have to reflect that. So we're trying to use a range of different media. Again, some of them are easier than others, but we are using social media, more traditional mass media, such as newspaper and radio. And actually, this is another place where the External Advisory Board has been really, really useful in helping us plan. So we have, as I said, people with dementia and families sitting on the External Advisory Board. And for example, when we were talking about using traditional media like radio to advertise, we kind of said, it'll be most cost effective and easiest to use a national radio station. That'll reach the biggest number of people. But we have people down from, say, North Galway, and they said, but we only listen to the local, whatever FM it is. So, you can't just think in terms of what's easiest or what's hitting the biggest number of people. You have to think about the groups that might never be hit. So it's definitely really useful meeting with the External Advisory Board as a sounding board and to come up with more ideas. The model then lastly asks us to think about the context. So looking first at the local context, we're kind of prompted to think about the organisational influence. So definitely as a university or as a research team, you have one type of credibility, but I think other organisations like dementia organisations or palliative care organisations have a credibility with other audiences as well, maybe. So it's really important to partner up with those. So for example, we found that working with the Alzheimer's Society of Ireland has been really, really useful because, as the model kind of prompts, they're both knowledge producers. So members of the society have participated in their surveys. They're also knowledge users because we're going to share the results with the society, and that might help them planning their own strategies. And they also act as a gateway for us to knowledge beneficiaries, so in passing on the messages to people with dementia in Ireland. We then spent some time reflecting on the kind of wider context of social, cultural and economic context. So thinking about the economic context, healthcare resources are always going to be limited. No matter how the economy is doing, there's never going to be enough resources for everything that deserves funding. So we did include 2 economic analyses in the project plan, so the willingness to pay and the budget impact analysis. What's really important is that we look at the language that comes out of these models, and that especially for kind of funders, for policymakers, for government, using that kind of language of cost effectiveness and showing the value of the model is going to be really important there. So again, it's just prompting to think about showing different groups how useful or how important our model is going to be, but using a different language to most effectively target each group. In that section, again, we were thinking about the wider cultural context, and I think there definitely is still a stigma associated with dementia, even though it is changing, thankfully, and a fear as well associated with availing of palliative care services. So as well as developing the model and the specific outputs that we're going to have, more broadly, one of our aims is to promote a better understanding of palliative care for people diagnosed with dementia and to educate people or the public in general that dementia is a terminal illness and therefore people with dementia can benefit from palliative care. So it's about both the kind of specific outputs we're thinking about and the broader aims that we hope to achieve. Okay, so that's just an introduction to the project and how we use the model. So when I was kind of planning this talk then, I just tried to write down any different ideas I had based on reflections after using it for 1 year. So these are just some of my thoughts. Some of them have been kind of mentioned already today. They're in no particular order, but the first one is the most important, that including key stakeholders is definitely a priority for the research project. So in our case, you might say that we had a bit more of a difficult task because it can be trickier to include people with dementia meaningfully in a project because their communication ability, for example, might be impacted. And I think in the past, people kind of said, look, we don't want to burden people with dementia. It's like was mentioned already with people with MND, they are a burdened group, but it's not okay to just say that they don't have time or we won't engage with them. You still have to give them the opportunity to do so. And definitely all the people with dementia that are on our group are really engaged and definitely are getting a lot from it, and we're getting loads from them. Working with key organisations is really, really important as well. So I mentioned already that different organisations are going to have more credibility, like the Alzheimer's Society of Ireland is very established. And think about how the different organisations might be able to share your message in different ways. So another example is that we have a representative from Family Carers Ireland on the External Advisory Board. And FCI do presentations about their work at nursing homes all across Ireland. So they said, so what we did, I put together just one slide with kind of the key messages and the key information about this project and gave it to Family Carers Ireland. And they put that into their kind of standard presentation that they use to introduce themselves at all the different nursing homes around Ireland. So that's just another way that the project's been kind of disseminated or just even advertised kind of more widely. I personally find it's been very useful to talk just informally about our project with as many people as possible. So whether that's, at conferences, just colleagues at work, or even just very, very informally. Because sometimes, you get so engrossed in your own research, you really know what it's about. And it's really interesting then when you talk to someone who has zero background in it or no previous knowledge about it to see how they react to it. And it has definitely been useful to kind of hear, are there any misconceptions? Or do people kind of misunderstand anything about the project commonly when you talk about it, and kind of use that feedback then to go back to the EMTReK model, go back to your worksheet and plan more messages. So in that way, it's always been kind of, as I said, it's always in draft and it's something, I've gone back to a lot. So that's been one useful way of getting feedback. Another one, this has definitely been mentioned a few times, but that definitely look very early on at the messages to be shared in the project. You don't need to wait until you've results to share messages. So one example from our model for dementia palliative care project is that we kind of knew from other research projects we had done previously that the general public, or even people with dementia, a lot of healthcare professionals, weren't aware that people can die from dementia, not just with dementia. So we knew from the start that was going to be one of those key messages to try and get out there. So definitely, we didn't need any results to start sharing that. So you can start disseminating and doing the knowledge transfer process from the very, very start of the project. There has been some resistance, not a lot, thankfully, but some resistance from certain groups who maybe aren't as readily open to hearing the kind of ideas that might come out of the project. But I think it's important, if you meet resistance like that, I feel it's really up to, say, us, the people who are producing the knowledge, or the researchers, to show them how the knowledge is valid. So look at different ways of getting your message across. Again, is it getting the cost into it more, making sure that the voice of the person with dementia is heard. So if you come up to that resistance, you can change your mind. So it's up to you to show how something is valid. This kind of relates to what I was just saying. So definitely don't assume that you know how different groups will react to your message at the same time. So while you might think that some groups are more readily going to hear what you have to say than others, don't assume that someone's going to be very positive or very negative. Feel it out first. And if you do need to, then you might need to go back to the model and change the message. Another practical one I think that has been really, really helpful is just to keep a record of all KTE activities. So I just have a Word file on my computer where anything that I can possibly call a KTE activity I kind of jot down. So it doesn't have to be a conference, it doesn't have to be a very specific event called KTE, but even chatting to people informally will count. So I'm just kind of keeping a record of all of that. And that's another method that's been really, really useful, to just go back and reflect on that and to look at, am I kind of, is there one message I'm talking about all the time and I'm missing out on something else? Or is there one group I'm targeting? Or is there one type of event I happen to be going to a lot? And using that, then you might be able to identify some gaps to plan further dissemination strategies. So that's definitely been a useful one. Yeah, this one came up a lot again. So if possible, it's great for a project if you can dedicate either time, so 2 hours on Friday morning every week, or specific personnel to KTE. Because I think these kind of knowledge transfer activities, there's not usually a deadline, or you're not going to get in trouble with the funder if this isn't done, usually. So it can be the thing that gets put on the back burner. So yeah, definitely either having a personnel who's dedicated to doing this, or just making sure that you set aside some time and stick to it every week or month or whatever it is helpful. I also found that using social media was really, really helpful. We're trying to expand that, and hopefully when the new KTE researcher joins the team, we will expand that a bit more. But so far, Twitter especially has been very useful. And I guess the last reflection is, it can be very exciting when you get all these messages down and plan your dissemination, your knowledge transfer strategy, but at the same time to realise that, change won't happen overnight and that change takes time. So just keep getting the messages out there and over time it will permeate. So I think that's it. So I just put up the project website and the Twitter handle there and the hashtags. So if you want more information about it, please do get in touch.